Good morning, sir. How are you?
Good morning. I'm doing well. How are you?
I'm doing well. I'm super excited for this project that we're embarking on.
Yeah. No,
All
me
right.
too.
You want
Yeah.
to tell the
Well,
people what we're doing here this morning?
yeah. So this is the Beyond Relapse podcast, where we talk really and help provide some support and information to families struggling with, sort of navigating their loved ones' addiction and sort of chronic mental health issues. Particularly families who have been through sort of the treatment cycle with their loved
Yeah.
one time and time again. And yeah, so we're going to talk, I think today a little bit about our stories, how this idea came about, and, sort of jump into maybe some themes and some discussion topics. So that's kind of the idea, and we can get more into that.
Yeah, brilliant. Yeah, I love that frame because as we talked about putting this project together and having a series of podcasts targeted towards certain things, something that was really passionate, I think, for both of us is this idea that treatment episodes don't necessarily yield recovery experiences.
Yeah.
And both of us, and we'll get into who we are and why we're here, but we work with families that have experienced multiple treatment episodes with their loved one, with their
Yeah.
son, with their daughter, with their spouse. And it's tragic, it's horribly frustrating, but we have this idea that if we send someone to care, we send one of our loved ones to care, they should get better.
Mm-hmm.
And in addiction treatment, more often than not, they come out of treatment not better, right? And by not better, we'll have to really dive into what we mean there because that's
Yeah.
nuanced too. So
Yeah.
really wanting to put something out there that's for that mom and that dad, that brother, that
Yeah.
sister, that spouse, who has been on this journey, who's been on a journey of treatment, relapse, over and over and over and over, and desperately wanting to have a lasting, sustainable recovery experience. But what ends up happening is they've just been caught in this cycle of treatment episode after treatment episode after treatment episode.
Yeah.
Yeah. Cool. And I
Yeah.
think as we have it lined out, we've got a series of about 13 or 14 of these on different aspects of that topic, and then who knows? We'll see where the world takes us after that.
Yeah.
Brilliant.
Yeah. I'm very excited.
Okay,
Yeah.
great.
I mean, sort of jumping into it, but one of the things that, I've really noticed working with families and sort of supporting them, and a lot of the families that I do work with are those that have, 5, 10, 15 treatment episodes under their belt that haven't been able to sustain sort of the progress that they want. And again, there's a lot of nuance to what constitutes progress and change.
Yeah.
But one of the things that I noticed as I was trying to find resources, and I'm continually trying to find resources for families, there is a ton of information and really good information around sort of navigating addiction, navigating treatment, but most of it is tailored towards the family that maybe has gone through this once or twice or hasn't gone through it at all.
Right.
And there's a lot of either early prevention or, this is what an intervention is. This is sort of why we're talking about boundaries, all these things, these concepts that are super important. But I would hear time and time again from parents in particular, like, hey, we've done 5 family programs. We've done 10
What?
family programs.
Exactly. What? Wait a minute. You want me to do another one of those?
Yeah.
I've
You
done
want
5.
I've
Yeah.
read this book already. I've read the other 3 you recommended. And, what can we access that's new, or, how can we make some of these things really actionable? Because that's the other thing that I've seen families struggle with a lot is, how do we apply these kind of abstract concepts like boundaries, like I'm blanking, but that's kind of the main one that I hear most of the time: communication skills, etc.
Sure.
How do we really make that actionable in our specific situation? Because they are so abstract.
I think you hit on it. It's sort of all of these things. How do we go from knowledge, information to practical tools that are actually affecting change?
Yeah.
In our family, but ultimately, I mean, it's always on some level. I think for the families, they feel that this is sort of this bait and switch, right? It's like, no, this is about them getting sober, and idiots like us, come in and we say, well, sure, that's true, but ultimately, what's more important than that is the family system and the change in the family system. And so then we give them the books, we give them the material, the knowledge, the tools, and how do you take that stuff so it's not just, for lack of a better word, this is going to be horribly insulting, I'm sure, but like a bunch of fluff, a bunch of stuff, right? And actually put it down on street level so it's doing something. And one of the things, on some level, my theoretical orientation has a lot to do with pragmatism. And it's got to be usable, and it's got to work, and it's got to do something, or who cares how great it sounds? There's a lot of really good sounding theory out there that a lot of people have tried for a lot of years that it hasn't really worked or helped. So
yeah.
Well, great. Well, that sounds like a podcast I'd listen to, Henry.
Yeah, serious business.
Yeah. Well, let's start a little bit, maybe kind of qualify, why are we here, and let's own this seat a little bit. Do you want to maybe start with an intro, and then I'll do mine?
Yeah, so my story a little bit. So I got sober pretty young, so I am a person in long-term recovery. I started in the addiction treatment field in community mental health detox, so that was my first role. And sort of cut my teeth in that. Some of the most impactful experiences of my entire career were in that first job where I had no training, almost no oversight whatsoever, and we're dealing with some really high acuity situations. Really fell in love with the field as a result of doing that.
Talk about the front lines, thrown to the wolves. Super young guy, newly sober.
Yep.
Right in the throes and the fires of detox.
Yep.
Nice.
Yeah, and social model detox, right? Minimal resources, and we're tasked with kind of doing all the things. So it was very interesting, to say the least. Yeah, and then I went and got my addiction counseling certification, went back and did some school, and and then worked in treatment for the next 6 years, and then about 3 years and some change ago, went out on my own and started my own, consulting, intervention, and case management practice.
Yeah,
and that's. Yeah, I live in Carbondale, Colorado, and with my friend Stefan Bate, who also lives very close, and just really love helping people, and using my brain and solving problems and kind of all those things. And my passion is those families that have really had a hard time sort of gaining sustainable traction.
Yeah, and I know in basically the 6 years of treatment experience, and then the 3 years of doing interventions, high-level clinical case management for families, often these are your families. These are the families that you've been working with. And, when you got that initial counseling credential and started as a therapist at treatment, I understand that you had sort of like the world's best supervisor on the planet, and you owe all of your success in life to the guidance and mentorship of this supervisor. Is that the case?
Brilliant, handsome, a great pickleball player. The whole. Package.
Tell me more.
Yeah, you bet.
No, and I appreciate that, and so for me. Like Henry, I'm also a person in long-term recovery, and in a way, this is something that's so important to me because I am this person. So my story is, very similar to Henry in some ways, but dissimilar in other ways. And part of that for me is I got caught for years in what I call the relapse, rehab, relapse, rehab, relapse, rinse and repeat cycle over and over and over again. And a little bit about my story is I really came into my addiction in college, managed to limp through college and finish it out. But by my senior year, I was an everyday drinker and fully addicted to alcohol. Alcohol was my main substance, although, Henry, I'm using whatever drug you got too. But for most part, it's alcohol. So ended up in a banking career, and again, then went through this 4 years of getting to a place where I was unemployable. My addiction took me to a place where I couldn't really show up for myself or anyone else. I'd go to treatment. I'd do great in treatment. I loved treatment, actually. I wasn't a resistant guy. I got an A in treatment. I loved it. Got out of treatment, would eventually relapse, sometimes very quickly, sometimes after a couple of weeks, never more than a month. And then we'd kick the whole cycle over again. So I am this person that ended up, by the time that I found long-term sustainable recovery, there were multiple treatment attempts and a lot of years in between when I really developed a problem with alcohol and drugs to when I found sustained, thriving recovery. So on some level, this is, a passion for me because of my personal life. Professionally, this is all the work I've ever done. And so my story, I was a commercial banker. I did that in Denver, Colorado for a while. I moved up to Carbondale, Colorado, where I got sober. Went back to commercial banking, did that for a couple of years into my recovery, and then the recession hit and turned out to be the best thing that ever happened to me personally, because it really gave me the motivation to change my life, to go back to school. Went back to school for counseling, became a therapist, and then a supervisor, a program manager. The last 9 years, I served as the chief clinical officer for Jaywalker Lodge, which is a long-term recovery continuum in Carbondale. And currently, for the last 3 months, I've been moved into a CEO position. So I'm a co-CEO at Jaywalker Lodge. And these are our families at Jaywalker Lodge. These are most, on average, our clients have been anywhere between 5 and 10 previous treatment attempts before coming to Jaywalker Lodge. So most of the men that I work with at Jaywalker Lodge and the families at Jaywalker Lodge, they're experiencing exactly what you and I are talking about. That, is another rehab actually going to fix this? We've been to 7. Why are we doing another one? What's going to be different this time? How often do we hear that question? We ask clients that question. We ask families this question. A lot of times they have no idea what's going to be different this time, or how it could be different this time. So,
and I would add, a lot of the time we as providers don't necessarily know the answer to that question either.
Yeah. So I've been in the field for about 16 years now at this point, and on top of doing a lot of program development, supervision. I speak across the country on different topics, this being one of them, but things like trauma, mindfulness-based interventions, clinical supervision, team and staff and program development topics, things like that, attachment, all kinds of stuff. So those are my passions.
Yeah. Stefan, can you talk a bit about, because I'm sure you've done a lot of sort of deep dive into, what sort of your emotional experience was going through that sort of cycle of relapse, brief, I wouldn't even say recovery, brief abstinence followed by another relapse. And also thinking about, what was that about for you? What were the dynamics at play that made it so difficult for you to make these behaviors that you worked on in treatment so often and really excelled at in treatment, and the struggle to make those sort of actionable?
Yeah, you bet. I think the emotional experience, it was one of deep shame, frustration, ultimately self-loathing, depression. I mean, it was literal hell. And I think we often deal with that with our clients and the families, but there is no worse place to be than in the middle of this ambivalent cycle of I'm not going to be using, I'm using. I'm going to be in recovery, now I'm relapsing. It's so much worse than just someone who's using, who really doesn't have any desire at this point to stop, or someone who's in full recovery. Being in that limbo place, that place in between relapse and recovery, is a literal hell that I wouldn't wish on anyone. For me, I think there was a couple of things that were going on. One, in the initial start of my journey, when I first started to have really challenges in my life, because that's where it comes from, right? Is, it isn't just that everything's going well, I've got good relationships, things are going good at school, I'm succeeding in my job and my career, but maybe I should just stop using drugs and alcohol. That said no one ever. Yeah. Right? Unfortunately, change often comes with, we call it a bottom, right? Or there's significant distress, there's significant problems, consequences going on. And for me, that started as sort of these material things, right? Like I wasn't able to show up for work on time. I missed days. I, was made a fool of myself. I, got into trouble legally with DUI, things like that. So that was the initial motivation. One of the things that I think is very common, and certainly was at play for me, is I desperately didn't want to be an alcoholic. I felt so much shame and stigma around this idea of being an addict and an alcoholic that even when I started to go to my first couple of treatments, I really wanted it to be anything other than a substance use disorder. Maybe it was some leftover childhood issues, right? It was maybe other mental health things. I would have loved any other mental health diagnosis just about than an addiction, right? So there was this sort of stigma, this shame that I felt that I really didn't want it to be true. So that on some level led to relapse, because it was like this, well, I just went through treatment, I've been sober, I did a lot of work on my mental health and myself, so maybe I can handle it this time. So there was some of that at play. I think another big piece, because after a while, you can't fool yourself anymore. You get enough evidence. You run that experiment of, can I control it? Can I handle it this time enough? And you learn that I just can't, right? Well, then I entered this period of, okay, I want to be sober, and then I would go to treatment. And the treatment that I would go to, it's common for a lot of people, is it was very short term, 28 days, and it was inside of four walls, on a campus in a building. So this really contained, very safe, very sterile, commercial, institutional environment. And I would go through this treatment, and again, I would do well. I would listen to the lectures, I would do the assignments, I would do the work, I would, practice the coping skills in the context of this treatment environment. And then I would get out, and despite desperately, really wanting to stay sober, when I got out into the environment, I got kicked out of treatment, I had no idea how to live in recovery. And what I since learned, that's very true for me, and I think true for other people, is the skill sets needed to stay in treatment and navigate treatment and do a good job in treatment and get a successful, we call it WSA, a with staff approval discharge from treatment, are completely different than the skill sets and the needed to live and thrive in recovery. And I had no idea how to do that. So I would go to this contained artificial treatment environment over and over and over and over. And it turns out I was really good at that. I was really bad at recovery. And I had no idea how to do recovery. And I had no practice living in recovery. And on some level, that's the problem that we all, I think a lot of us faced, is that this treatment episode did not bridge the gap to recovery experience into long-term, sustained, thriving recovery. Well, what happened for me is the last treatment that I went to, I ended up going to a very long-term treatment that was very much integrated and connected with the community at large. So I got to practice living life as much as possible at different levels, right? So it started out more structured, more contained, but as I moved through this continuum of care, it became much less structured. It became much less about treatment and much more about recovery and life. And I got to practice exactly what we're talking about. I got to practice these skills, these tools, this balance on street level. Mm-hmm. So as much as possible, my life got to be exactly like it would be when I was no longer in treatment. At the same time, because I was out in the world and I was out in community doing this while still connected to this treatment program, I was able to build my own real-world recovery tools, recovery skills, recovery capital. I was able to create real relationships with people in an authentic way. Not treatment relationships, not transactional relationships that would be over the minute that I was outside of treatment, but real authentic connections with people that were going to be in my life while I was in treatment, but also while I was out of treatment. So this network of people started to build and build and build. And what we know, particularly for people in addiction, is that the social aspects of recovery are so unbelievably powerful. Yeah. And you know, there's not a lot of things that we can measure that predict recovery success, but one of them happens to be our recovery network. And research shows over and over and over again, the more people that we have in our life that are supportive of our recovery, the better our odds. And so that started to happen for me. And I stayed, in treatment for many months, which, on some level was hard for a guy like me because I have this ego. I think I'm pretty smart. I think I can figure things out pretty well. And getting to this level of humility that actually, when it comes to addiction, I don't have, my unaided resources are not sufficient to take care of this problem. So that sort of humility that it's gotta come from outside of me. I'm not going to be able to do this on my own. So that's a big part of it, and I think for us in this podcast and the families that we're trying to work with, those are the families we're trying to reach, right? Because we have a problem. If you look in our field, we've got a big problem. If we're professionals in this field, I've been a professional in this field for, coming up on 16 years. You've been a professional in this field for over a decade. On some level, we've got to get really humble here. And accept the fact that we're just not that good at this. And what I mean by that is, by and large, people don't find sustained, successful recovery coming out of treatment. Most of the time, it takes multiple treatments. So we've got a big problem. You always see those T-shirts that sometimes kids wear, or the memes where it's like they got this treat. It says rehabs for quitters. You've seen that. It's well, unfortunately, rehab's not for quitters by and large, right? And here I am. I'm a CEO of a treatment center, and I'm saying often rehab doesn't work, right? Yeah. So that's the problem, And if you look into the literature on this, it shows that on average, it is about 8 years by the time from 8 years from the time somebody meets criteria for substance use disorder, and then finding sustained remission as measured by a year or more. So it takes 8 years from the time that someone meets diagnostic criteria for a disease until they find actual sustained remission. That's wild. There are not a lot of other diseases that it takes 8 years for the treatment to actually take effect. In those 8 years, we're often looking at, again, 5, 6, 7, 8, 9, 10, multiple treatment attempts, inpatient, outpatient, individual therapy, psychiatry, life coaches, recovery coaches, ministers, priests, rabbis, lions, tigers, bears, oh my, right? We're throwing the kitchen sink at this thing. Ultimately, I think for families to feel like it's not working or it didn't work. right? Or it was all a failure, and we're in the same place we were years ago, treatment episodes ago, right? So I think if that has been your experience or your story, or and you're either on the other side of that experience and story at this point, or you're still right smack dab in the middle of that experience, that's what we're aiming to do. I think that's what this series is about and who it's for. So
yeah, one of the what you made me think of, you made me think of a couple of things, but when I was working in treatment in particular, and I notice it now, of course, as well, but, I'd have so many clients that would come to me and, they'd be talking about essentially an AMA, right? An against medical advice discharge from treatment.
I'm getting out of here, Henry. I'm done with this treatment business.
And what they would often quote or cite as the reasons that would be okay was around, hey, I'm feeling so much more connected. I feel like my mood is great. I'm bought into all the stuff y'all are talking about in terms of 12-step or another sort of peer support program. I've done really good therapy. I have good insight. And what I would always notice, it's like there was always a disconnect for them around why they felt so good, and what was the actual infrastructure sort of behind and around them that was supporting an increase in baseline mood, an increase in feelings of connection, all these things that were working so well. And I don't want to discount that, right? They were working well, but what people had a hard time recognizing was most of that infrastructure that was supporting them in all those things was treatment dependent, right?
Correct.
It was there was a level of, and I don't mean this disparagingly, but sort of synthetic connection, right? That's part of what treatment is designed to do, right? It makes it harder for you to not engage than to engage, right? In the community, right? People are surrounded in a really supportive space with like-minded people. There's a schedule and a routine that, again, it's easier to go along with all those healthy behaviors than it is to sort of resist them. And then they would get out of treatment, and suddenly most of their community, most of their recovery capital was determined to be, again, dependent on the treatment program, right? And so they would really struggle, right? Really struggle sort of engaging in those tools, because the world, by and large, is not necessarily supportive of recovery, right? There's not a whole slew of people around us supporting all those behaviors and encouraging them. And I like what you said about, I think we're still very, very new in considering sort of a chronic disease management model of treatment. I think that's very, very new. For the longest time, going back to the 80s, it was really, and I think 12-step, there's very good research to suggest that 12-step is one of the most effective sort of long-term recovery programs for people. But, in the 80s in particular, it was all 30-day programs.
Right.
And then we'd sort of pat people on the back and say, go to AA. And that was kind of what we got. And I love that now we're transitioning to a continuum of care, just like we would in any other sort of chronic disease. You go to the ER, you go to the ICU, you go to PT, whatever the injury or malady is. But I think we're still catching up with that. I think that's still a really new idea in a lot of facets of behavioral health.
Yeah. I completely agree with that. I think that's really important. We're really caught up in this medical model where it's really we're looking out at recovery through the lens of a clinical, medical, acute care lens. Mm-hmm. And I think when you look at healthcare in our country, both physical healthcare and behavioral healthcare, we're really good at crisis. Mm-hmm. And we're really good at managing acuity. But there's a huge difference between managing acuity, delivering crisis level care and interventions, and promoting lasting long-term change and recovery. And that's not just seen, the analogy that is just so old and overused and dead, and I kind of hate myself a little bit for even bringing it up, but it's like we see this in other chronic diseases. We're really good at managing and delivering emergency level care to someone as they're having a heart attack. We're really terrible at helping to facilitate long-lasting lifestyle changes for someone so that they don't have their second heart attack. The greatest predictor of a heart attack is that you've had one before. That's crazy, right? I mean, on some level, I guess that makes sense. But on some level, it's like, yikes, we should be doing a little bit better than that, right? So when we think about this, it can't be about treatment, because I think what you said is super important, and this happens all the time. Clients, their functioning is being artificially supported by the structure of treatment, but they don't know that and they can't feel that.
Right.
It's almost like the fish in water. Everything in that fish's life is supported by the container of that ocean, that river, of being in that water. But the fish just thinks it's the fish doing what it's doing all on its own. Right. Remove that fish from water, and all of a sudden, and that happens with our clients all the time. How often do you hear, Henry, especially in inpatient treatment, I feel great, I have no triggers, I don't want to use, I'll never use again, I really want it, no part of me is triggered. In fact, I saw someone on TV drinking, and it didn't even want it, didn't do anything for me, to me. I'm great. And then they get out of treatment, and 3 days later they're using. And all of a sudden, those triggers, that craving, it all comes flooding back. And one of the things that you said is so important. It's, if the only thing that's in between me and my addiction is treatment is going away. So I have to have things that I own, that belong to me, that are internalized, that are in between me and an addiction. And the problem is all of those things are developed in recovery, not in treatment, right? Yeah. So that's the thing is, it's not about treatment. It's also not about treatment. And by no means, I think, are we saying that treatment doesn't work, don't go to treatment, treatment isn't important. I think what we're saying is that if we're looking through the lens of medical clinical treatment out at recovery, hoping that this will get to that, we're in trouble. But if we can sort of flip this around and we can keep a focus of a recovery lens and use the principles and the practices, the habits, the rituals, the routines of recovery, and if we can help people in treatment to develop high levels of recovery capital, then all of a sudden this treatment episode is going to bridge to a recovery experience. And I think on some level that's the practical application of this series, right? We're wanting to help people and help families sort of understand how this works, right? And how we go from this endless cycle of treatment and relapse to a treatment episode yielding an authentic, thriving, independent, launched recovery. Yeah.
Stefan, can you talk a little bit more, and then I'll weigh in as well, to where the family sort of fits in all that? Because we're talking a lot about the individual, which is a huge piece of the puzzle. But one of the, as you said, right, so the challenges with sort of sustained remission, the continued treatment episodes, one of the traps that I think families fall into all the time is this idea, when my loved one gets better, I'll feel better. And it's like, how does the family factor into that, right? In sort of their own healing process? Or some of the challenges you see.
I mean, on some level, I think something that we don't necessarily acknowledge or think about is if you are a family member that has been on a recovery and an addiction journey with a loved one, you yourself are traumatized, right?
Yeah.
It has a profound impact on you, your relationships, your mood, your ability to thrive in the world, right? Often what happens, though, is we get so focused on we call them the identified patient, right? Or the person of concern, or the addict, right? We get so identified on them, their process, their healing, their recovery, them, that we often miss as family members a lot of things that we can do to, one, actually take care of ourselves and feel a lot better, but two, actually take hold of the things that we can control in this recovery process, in this addiction process, that can lead to meaningful change. And part of that, what families, I think, hear over and over and over, is that this is a family disease. Well, what does that mean? Well, it means that on some level we're in a system. And you can think about a family system just like any other system, like an engine in a car, gears and cogs and levers and doohickeys and a clock. I don't actually know anything about how anything mechanical works, but you can think about a mechanical system, right? A digital system. Well, what we know about systems is they're interconnected. And if one part of a system makes a change, it will impact and affect all other parts of a system. So if I'm a family member and I'm reading, the books, I'm going to the family, I'm going to that cute lecture on the Thursday afternoon at family program about self-care, I can't ultimately control what my loved one does. I can control whether or not I'm going to make changes in my life. And if I make changes in my life, the system is then going to be impacted and affected and changed. And the likelihood that the loved one that I've been spending all of this time, years, money, thrown all of these resources into to try to help get into recovery, actually the greatest thing that I can do to have the most impact on whether or not my loved one makes the changes that I want is to actually focus on myself and to change myself.
Paradoxical.
I think you got it. Absolutely. It is paradoxical. I think the other thing is we talked a little bit about the shame and the stigma that I felt in my story, as a person seeking recovery and returning to use. Families have an unbelievable amount of shame and stigma that they hold as well. And often these, particularly parents, but spouses as well, they feel like on some level I'm responsible. Had I done something differently, this wouldn't have happened. And we throw around the big E word, enable, right? And I enabled this, and I'm not, So families also have to, I think, wrestle with and navigate that shame and get to a place of acceptance and self-forgiveness and self-compassion. If we can do that, if we can get to a place of acceptance, then we actually get to a place where we can implement the other dirty word, boundaries, right? And so we'll talk about all that. But essentially, I break this down and I make it really simple for families. Let's throw away the blame, let's throw away the shame, and let's get really clear on what is it that we as a system were doing that enabled someone to continue to use or to use more easily. What are all the things that we have now learned, again, without blame and shame, just with awareness? Because the truth is we were doing them for really good reasons. Yeah. All of the enabling behaviors that families do were done because they loved and they cared and they wanted to protect and they wanted to save their loved one's life. They were all done for incredibly good reasons. Yeah. The thing is that we're dealing with this incredibly complex disease where so many things are sort of counterintuitive on how we have to implement change. And one of the things that's very counterintuitive is what support looks like from a family member in a family system. So with professional help, we get really clear, again, without defensiveness, without blame and shame, we get really clear on the things that we were doing that enabled someone to use more easily. A lot of times, those are financial things. We were providing financial support in some way that allowed someone to continue to use. Often it's that because we so much wanted to protect someone, we did things that kept them from feeling consequences. And what happens is if we keep someone from realizing and feeling early consequences that are probably less damaging, right? Less critical consequences. What happens then is they sort of skip a level to the next level of consequence. And those consequences are more damaging. So then if we keep someone from realizing those, we then skip another level, right? So ultimately by keeping someone from realizing and feeling and experiencing the earlier consequences of use, we kick the can down the road to deeper levels of consequence, where ultimately the consequence that we can't keep people from experiencing is death in their addiction, right? So real simple. We get clear on what those things were, and we become committed to no longer doing those enabling behaviors. Simple. We will no longer do these things. At the same time, again, with professional help, we get really clear on our commitments to supporting recovery and what those commitments to supporting recovery look like. And then as a family, we decide we are going to commit to and support recovery. We're going to do anything that we can do, anything within our ability as a family to support recovery. And we're committed to no longer doing any of the things that we've identified that will enable someone to continue to use, more easily use, or return to use. Right?
Totally. Yeah, I love that you mentioned trauma, right? And I don't think we talk enough about, I notice time and time again, I mean, families so often, particularly at the beginning of their sort of treatment process with their loved one, I'm thinking the more sort of acute stages of care, I mean, all the symptoms that they presented with were PTSD symptoms, right?
Totally.
Intrusive thinking, hyperreactivity,
hypervigilance,
all of it.
Yeah.
All of it. And I remember
massive anxiety.
Yeah. And I remember when I was working in treatment, I had to be so careful calling from my area code and being able to house that in a, because I worked in treatment in Carbondale, and I knew that the 970 area code popping up on these families' phones immediately would put them into, our son's leaving treatment. He's AMAing from treatment, and he's not going to be okay. And so I would always
trauma
say,
response.
Hey, this is Henry. Everything's okay. Just calling to check in. And then there'd be sort of a pause and a sigh on the phone, of relief. And then we'd talk about what we were going to talk about. But, I think when you mention, the things that families can do to really support themselves and as a result, positively impact their loved one in the system, I think a big piece of that is just self-regulation. And one of the challenges that we have with, I think, a majority of family supports being educational is the part of their brain that they need to access that information in the moment is the part of the brain they don't have in that
They don't
moment.
have going.
Right.
100%. Well, it's why, I don't need to go to the Fifth Family program. I've been to 4. Really what they're saying is I've heard the lecture. I've gotten the information. I understand the information, and but this information hasn't actually led to me feeling better, and it certainly, at treatment number 6 hasn't seemed to have impacted whether or not my loved one is actually going to get sober this time, right?
Yeah.
So,
And
another rehab, right? Another family program. Our families need relief.
Yeah. And they need the ability to make these things actionable in real time, right? On the street, as you mentioned, where on the phone call with their loved one who is, up to all kinds of things, in regards to demands and, sort of engaging in addictive process or trying to, the ability to self-regulate, the ability to think strategically and long-term as opposed to based on, emotional reaction. I think that's super important, and certainly something that I want to talk more in later episodes about. How do families actually do that?
You bet.
I also love that you mentioned sort of the shame and blame that can come up so often for families. And I do feel like we have to be really careful as providers to not further solidify that narrative that y'all both did something wrong and are doing something wrong.
Right.
And the thing I like to say to families, this quote has been stolen from lots of people credit themselves with this quote, but it's the idea, this isn't your fault, but it is your problem.
Yeah, oh, sure.
Right? For whatever reason, your family system has sort of molded into patterns of behavior and reactivity and a level of just kind of baseline anxiety where people are trying to feel okay and feel safe as best they can, and that at this point is impacting outcomes, is impacting the quality of life of everyone involved, and what do we do about that?
Yep.
And I think that's a lot of what you're speaking to is like how do we think pragmatically and proactively as opposed to just sort of belittling and being hard on ourselves for doing the best that we could with what we had at the moment,
Indeed. And then we give people, the C's and the D's, right? The 3 C's. We tell families, hey, you just got to, remember you didn't cause it. You can't control it. You can't cure it. Well, on some level, that's great because that, it helps someone to sort of hopefully use that to let go of some personal blame and shame and responsibility, but also then leave someone what the hell do I do then? Okay, that's wonderful. I didn't cause it. I can't control it. I can't cure it. And I'm, 6 treatments and God knows how much money into this. So what do I do? Right. And the C's are for the families. The D's are for the addiction, right? We know that addiction is going to do anything it can do to deny, discredit, destroy. Right. So, and I think that's a good segue, right? Because I think next time what we're going to do is really dive into what are the real costs of treatment and what does this look like in this landscape, and start to sort of move into what is a solution, right? And what are some of the things that we start to do to maximize our resources, right? And I think this episode, this first one was all about sort of framing up the why and the problem of this podcast, right? Which I think we did a really nice job of doing. Unfortunately, for people listening, if they're in the middle of this, we probably just brought them way down into the swamp, right? It's sort of all this experience of really frustration and not getting a good outcome, right? So I think I want to say as we start to close it up here, like, don't worry. We know we took you down into the problem, and we had to frame that up to really talk about why we're doing this. But we're going to bring you back out of it. And the good news here is there is a way out of this, and there is a roadmap, and there is a solution, and there is a method from going from rehab, relapse, rinse and repeat to sustained and thriving recovery. And Henry and I have seen that happen for hundreds, if not over 1,000 clients and families over the years.
Yeah, and I would just add, I know it is very possible for families, regardless of the outcome of their loved one, and to reclaim their lives, right? And to have a quality of life that they don't have today as a result of some very pragmatic and I think pretty reasonable actions taken over time.
Yeah. I'm so glad you said that, because that's actually 100% accurate. It's regardless of what ends up happening on a change level for the person of concern, the identified patient, what we also have experienced and know is that these families can end up living a great life and having the life that they both want and deserve, regardless of what happens. And that, for a family, for a mom, for a dad to hear that just sounds insane, right? The idea that whatever happens, no, we're not saying that it won't be hard or won't be sad or tragic, whatever. But what we're saying is that you can have an incredible life that you both want and deserve.
Mm-hmm. Yeah, you bet.
All right, man. Well, this is fun.
Yeah. Thank you so much, Stefan.
Yeah. Thank you, Henry.
As you said, next week, we're going to be talking about, the cost of treatment and, again, sort of diving in a little bit more into sort of some of the problems, but also some of the solutions and ways that we can both maximize, think more strategically and long-term about, treatment, and how do we foster organic recovery so we can get, the outcomes that, every family wants for their loved one. So we'll talk about that next week, and thanks so much.
Sounds good. We'll start to move out of the swamp. Yeah. Perfect.
Yes, exactly.
Thanks, Henry. This is fun. I'm having fun doing this with you.
Likewise.
Right. Next time.